Hi, my name is Angela, and today I'm going to be performing the neuro assessment on my patient here. First, I'm going to start off by cleaning my hands. And we've already gone over the health history questions. And so now I can begin my assessment. First, I'm going to start off by assessing his olfactory cranial nerve number 1. So, close your eyes, please. Have something in this cup, and I'm going to have him smell it and tell me what he smells.
Coffee.
Okay. Very good. So cranial nerve number 1 is intact. And now on to cranial nerve number 2. I would be doing the Snellen and confrontation test, but we've already done that before. So that cranial nerve number 2 is intact, which is the optic nerve. And then on to cranial nerve number 3, 4, and 6, which is the oculomotor, trochlear, and abducens. So to do that, I'm going to assess Perla first. So please look forward for me. Straight ahead. I'm going to shine a light in your eye. And the light is dead.
No.
I know. I'm going to use my phone light instead. So look straight ahead for me. Okay. Now from the other side. Okay. So both eyes are equally reactive to light. The pupil size is also equal. And they both constrict with light. So next we're going to do the 6 cardinal gazes. So I'm going to have you follow my pen, the top of my pen. So look straight ahead for me. And now I'm going to start here and just follow my pen. Okay, so cranial nerve number 3, 4, and 6 are intact. He was able to follow the 6 cardinal gazes. And next we're going to move on to cranial nerve number 11, which is the spinal accessory. And so I'm going to start off. I'm going to put my hands on your shoulders and I want you to shrug. Okay, good. And then I'm going to put my hand on your face and then I want you to turn like your head this way and this way. So turn to your left. Okay. And turn to your right. Okay. So the cranial nerve number 11 spinal accessory is intact because he was able to shrug against resistance and he was also able to turn his face against resistance. So next I'm going to be looking at his tongue to assess the hypoglossal cranial nerve number 12. So please stick your tongue out and I want you with your tongue out to say light, tight, and dynamite.
Light, tight, dynamite.
Try to keep it left out. So like, don't use your tongue.
Light, tight, dynamite.
Okay, good. So let me take a look at your tongue, please. And then can I have you go side to side? Okay, good. So his tongue protrudes midline as it should. And also his lingual speech is clear. So cranial nerve number 12 is intact. Next, we're going to move on to cranial nerve number 5, which is the trigeminal nerve. And to do that, I'm going to have you, I'm going to feel for the temporomandibular joint. And I'm going to have you clench your jaw. Okay, good. So I could feel his jaw clench, which means that cranial nerve number 5 is intact. Also, I'm going to close your eyes for me. I'm going to touch your face with a piece of cotton and I want you to say now when you feel it on your face.
No.
Okay.
No.
So cranial nerve number 5, the trigeminal nerve, is intact. Next, we're going to do cranial nerve number 7, which is the facial nerve. And I'm going to have you smile, frown, frown, and puff your cheeks, like close your mouth and puff your cheeks. Good. Show your teeth. Okay, raise your eyebrows. Okay, so he was able to do all of those facial movements, which means that cranial nerve number 7, the facial nerve, is intact. And one more thing, can you close your eyes real tight for me? Okay, good. And then next we're going to move on to cranial nerve number 8, which is the acoustic nerve. I would be performing the whisper test and having the patient relay what I say to him as I'm behind him and whispering, but we've already done that before, so we don't need to do that again. Next, I would move on to cranial nerve number 9 and number 10. That would be the glossopharyngeal and the vagus nerve. So I will be inspecting his uvula and his soft palate. So please open your mouth for me. I'm gonna have you stick your tongue out and say "ah." Okay, good job. So cranial nerve number 9 and number 10 are intact because I could see his uvula and his soft palate rise when he said "ah." Next, I'm going to move on to his muscles. So I'm going to inspect. So muscles look symmetrical. There's no abnormalities. And now I'm going to need you to use both your hands. Squeeze my fingers for me. Okay, good job. So hand grips are strong and equal. And next I'm going to have you, hopefully there's enough room, I'm going to put my hand on your thigh and I just want you to lift your leg. Okay, good job. Next one. Good job. So hand grip strength and the strength in his upper legs are bilaterally equal and they're strong. Next, I'm going to move on to gait. So I'm going to need you to stand up for me and just take like 5 steps that way. Okay, good job. So his gait is balanced, it's coordinated, and there's no swaying or any abnormalities. And next we're going to do the Romberg test. So I'm going to have you stand up, put your hands to your side. Okay, and I want you to close your eyes. I'm just going to assess your standing for a couple of seconds. Okay, good job. You can sit down now. So the Romberg test was negative because there was no swaying or any loss of balance when he stood up and closed his eyes in place. So next I'm going to move on to rapid alternating movements. So what I'm going to have you do, I need one of your hands, or actually I think we're going to do both hands, but I just need you to take your pointer finger of one of your hands and I just want you to touch my finger. Okay, good job. And now the other hand. Okay, good job. Now we're going to do something like that again, but you're going to touch your nose and then my finger, nose, finger, nose, finger. Okay, nose. Okay, next hand. Good job. So rapid alternating movements are intact. Next, we're going to move on to pain and light touch. So for this, let's see. Okay. So I need you to close your eyes, please. And I'm going to touch you either on your arms or your legs. And I just want you, when you feel it, just tell me where. You could say upper right arm, lower right arm. No, actually, sorry. I'm going to be doing your arms and your hands and also your upper legs and your lower legs. So I just want you to tell me where you feel it when I touch you. Okay, close your eyes. So I'm going to start off, keep your eyes closed. Start off with this object. So
Arm. My hand.
can you say left or right, please?
Left.
Okay.
Right hand. Right arm. Right leg. Right leg. Left leg. Left leg.
Okay, and can you tell me if that object was sharp or soft?
Sharp.
Okay, good. And now I'm going to do the same thing, but I'm going to use a different object. Close your eyes.
Left arm. Left hand. Right hand. Right arm. Left leg. Right leg.
Okay. And can you tell me if that object was sharp or soft?
Soft.
Okay. So pain and light touch is intact. He was able to identify where I was touching, and he was also able to identify if it was a sharp or soft object. Good. So next we are going to be doing, let's see, kinesthesia. So with that, I'm just going to have you close your eyes and put 2 thumbs up on your legs. Yep. And then I'm going to be touching your thumbs. I just want you to tell me if I'm touching at the top of the thumb or the bottom of the thumb.
Top. Bottom. Top. Bottom.
Okay. So kinesthesia is intact. He was able to identify where I was touching on his thumb. So that's good. And then next we're going to move on to sterignosis. So I'm going to put 2 items in your hands, a different item in each hand, and I want you to tell me what they are.
Okay.
You should be able to feel what they are. Close your eyes. Okay. 1 here and 1 here. Close your hands and please tell me what you feel.
Quarter and ear pod.
Good job. So, kinesthesia is intact because, oh, sorry, that wasn't kinesthesia. That was sterignosis. He was able to identify what items were in each of his hands. Good. So, next we're moving on to graphesthesia. So, I'm going to take your hand and I'm going to use my finger and I'm going to draw a number on your hand. Please try to identify what the number is. Okay? One more time.
5.
Okay, good job. And now I'm going to do another one on this hand.
3.
Good job. So graphesthesia is intact. He was able to identify the numbers that I drew on his hands, which is good. And lastly, for you, I'm going to have you put your leg out. And then I want you to please point your toes. Good job. That's plantar flexion is intact on the right foot. And now I want you to bring it back as far as you can. Good job. So plantar and dorsiflexion are intact on the right leg. Now same thing with this one. Point your toe. Good. Now back. Good. So plantar and dorsiflexion are equal and bilaterally intact on both lower extremities. And for the deep tendon reflexes, I don't have a hammer, but if I did, what I would do is for the patellar, I would take the hammer and hit right below the patella, and I would see the lower leg come up. And then next I would do the biceps and the triceps. So I would have my thumb in the antecubital fossa, and I would lightly tap my thumb with the hammer, and I would see the bicep and the tricep have a slight movement. And then I would also do the brachioradialis. So I would put my thumb on the lateral side, lightly tap it, and I should see the wrist move a little bit. And then I would do the Achilles. So I would lightly tap the back of the foot and see the foot move a little bit. And then we already did plantar and dorsiflexion, so that is the end of my physical assessment.